Hello, everybody. My name is Alex Castillejos here in Just Be Blessed. Thank you so much for being here another night going Facebook Live. And let me tell you, tonight is going to be a really special night. You know why? Because we invite a very special guest. That's right. And we're going to be talking about this terrific epidemic. I mean, it's really bad disease. It's not just here in the United States, but it's in the whole world. Coronavirus, that's right, and it's taking the lives of the loved ones, and it's very serious. And I invite a doctor, that's right, a Sheeba Mesghali, and she's here with us, that's right, and she's going to hang out with us. We have some questions. If you have any questions, please just share with us here in the comment reaction. You know how it's here in social media. If you like this platform, you like this video, you like the stuff that we're talking about, make sure to like this video, like, hearts, and don't forget to subscribe, follow us here on Facebook. And this video also is going to be in our YouTube channel. That's right. Next week is going to be in our page in YouTube, and Just Be Blessed. We share people's testimonies and uplifting messages and how God is good. But we invite people if they have some positive message. And right now, let me tell you how we're living. We need to invite, we need to share in social media some positive. What do you guys think? That's right. So let's welcome Dr. Sheeba. And thank you so much for being here, Sheeba.
Thank you for inviting me.
Yeah, for sure. And let me tell you, I know we hear in the news, right, and social media, how this disease it came to the United States, right? But can you just share with us, maybe a lot of people, they don't know you. So can you introduce yourself, please?
Yes, my name is Dr. Sheeba Mesghali Morales. I'm an internal medicine and pediatric physician in Venice, Florida. And at this point, just doing outpatient clinic.
Nice. And like today, like I was saying, what is the update of this crazy virus, COVID-19? I mean,
so I have to be brutally honest. Today, I have not looked at any CNN, MSNBC. I'm trying really hard not to look at bad numbers. I'm just looking at our own city and seeing that there are more and more people affected just here in our county and our small community, and how it's progressively, worsening in the state of Florida to the point that now they're talking state of emergency, although we are not on complete shutdown.
Okay. Well, let me tell you, I live in Oregon, so it's the opposite, the whole, on the West Coast, and Oregon is not locked down like California is. But the governor, she said that, if you don't have to go outside, and the social distance, right? It's very important. And shut down and lock down and everything. But Florida, we're gonna be talking about Florida because it's been in the news lately. And let me tell you guys, this is not news or anything political or something, but it's nice. It's good to to talk and like I said, this space is just to hang out, right? And just casual and invite some,
some positivity.
That's right.
To this terrible disease.
Yeah. Yes. So what are your thoughts? Just for your thoughts of being a doctor or being a human. What do you think about this crazy disease?
I think there's two perspectives. I think a lot of people are looking at this and saying, well, it's not as bad as influenza, and people die from influenza and the tens of thousands yearly. And why such a big deal with what's going on currently, which is there's, no vaccine, there's no actual medication that's been approved for this. And I think this is what makes it scary, how quickly it is progressing around the world. And we can only look to the people that are going through this before us. And currently looking at, Spain and Italy going through the worst of their peak, how this could be us in just 2 to 3 weeks from now. And I think even as a United States, you're starting to see hot spots. And I think, unfortunately, Florida will be more than likely the next big deal. And so I think for me as an outpatient clinic today, our update was to stop seeing healthy people and doing, well exams on adults or children that don't need to be in the office or outside of the home.
Mhm.
So just we're really trying to push anybody who has symptoms of COVID to the emergency room if they follow criteria, fever and travel, etc., versus bringing that into our small outpatient clinics. So focusing basically on back pains, leg ache, a child with an ear infection, instead of putting us at risk of somebody coming in with symptomatic COVID.
Wow.
Of course, we don't know who's out there asymptomatic walking around until it's probably too late.
Wow. I mean, that's yeah. I have some questions, and
Sure.
I'm gonna start. I mean, that's the whole reason of the show, right? I mean, I have some questions for
Absolutely.
you, and please, help us out, right? Uh,
Absolutely.
so, as a pediatrician, right,
And internist.
and internist, okay.
Mhm.
Somebody asked me this question. They said, "What are the long-term impacts these can have in our infants, children, teens, if they end up contracting, the virus?"
And that's an excellent question. And I think since we're in the first phase of this new
Mhm.
disease, I mean, we have coronavirus for many years in different, strains. But, the only thing that I have seen as I'm part of a big group on Facebook of what's going on with physicians all over the country, I don't think any of us really know what the long term effects are going to be since we're in the acute phase. But more than likely, they have discussed with the adults that there will be some repercussions of respiratory or lung issues for their future. And of course, if you look at children right now, we can tell you that emotional distress and psychiatric issues with this staying at home and not being able to go out and sort of isolating could have some repercussions.
Yeah, because let me tell you, I don't know. I mean, no, 2 weeks. I think is 2 weeks so far for no school. And I think
Yes,
that's enough, right? But you
right,
cannot go outside, or well, in California it's locked down, so you cannot go to the parks and stuff like that.
right.
In
Which
Oregon, you
just occurred. Yeah, it just happened here for us today, the national parks and playgrounds. But of course, we've been on spring break a week ago and then jumped into this
yeah,
epidemic, sort of the schools closing until mid-April for now.
yeah.
We're not guaranteed a date, but I think school will start in the first week of April online, which is going to be a whole experience for
Mm.
parents and children to be homeschooled.
So this is, I know we can talk about seriously like 4 hours about
Right.
this topic and financial
Sure.
stuff and school and all the stuff, but this virus, I mean, it changed our lives and the whole
Everyone.
world. I mean, it's not just here in the United States or Mexico or Italy,
Right.
right? I mean, poor those
Right.
guys, right? And
Right. Right.
really changed our lives and how we do things, and sometimes we don't think about it, right? I mean, somebody just you go to the restaurant, stuff like that, and then you give you the credit card, and it's like, now I'm like,
Don't touch my card.
I know, seriously,
Yes. Yeah.
and
Yeah.
it's very bad. So another question: um, how long is a person can carry of the virus? If no symptoms shows up in the 14 days, are they still a carrier? If so, until when? Until
And
then,
that's
sorry.
another thing we don't know. I don't think anybody's stopping to sort of examine the asymptomatic people. We're not even getting tested. So unless there's a group somewhere in some university that is checking people just randomly, asymptomatic, symptomatic, and says, let's follow this person for over the next 2 weeks or a month or whatever, I don't think we're going to have definitive answers. I know that they were stating that the people that were on the cruise ships
Mhm.
that came into California, that even 17 days later, the people who had tested positive, their rooms still carried the coronavirus. So I don't know how long they're going to continue that testing to kind of see how long it can live, because we're all looking for an answer on cardboard and paper and surfaces and how long they're present. And I don't know that we have definitive answers for anyone on that.
Wow. Wow. So you told me after 17
Days.
days, the person had it or the whole room? It
I
was
think the
infected.
room was still being tested even though they were off the ship. So I think that, it's still alive, and I think that they're probably going to use that as a grounds for studying
Yeah, of
to
course.
see, how long it lives. And
Yeah.
I don't know how long people are going to be carriers, but we're not going to even know that because we're not testing asymptomatic people who might be carriers unless you're famous or,
Yeah, you're right. So to have a test, it costs money. It's free from the government or the clinic, the hospital. How does that works? Can you help us out?
So, according to what the federal government is stating and the Trump administration, that regardless if you have money or not, if you have insurance, if you're uninsured, if you have Medicare, this testing should be free. They're not guaranteeing that the treatment will be free, but the testing should be free for anyone
Okay.
as long as you fit the criteria. So I think because we don't want to use tests unnecessarily, particularly all the healthcare workers who, more than likely quite a bit of people are positive for COVID but aren't being tested. We really have a very skewed number every day of, deaths to how many cases, because really we don't have the legitimate number of cases since we are not checking asymptomatic people or carriers. For example, if your mother comes home and she's COVID positive and now she's infected husband, grandma, and 4 kids, they're not going to test them. More than likely, they're just going to tell you to stay home unless you become symptomatic or severely sick that would require, admission to a hospital or an ICU.
Wow.
So I think the numbers are probably more than double of what you're seeing on the screen, for the day.
I'm sorry, but that is very scary. I mean, just to think
But
about it.
in a lighter note, though, if you take that number of what they show as the cases and double it or triple it to the percentage, then decreases for how much it is causing the death. So if you look at that, you're seeing a much higher number of percent currently. But if we took into account how many people are really out there with the disorder, then the percentage looks better as far as deaths.
Wow. Okay.
And I don't think that's just here. I think that's everywhere. I think they're testing more in other countries. I think they've tested more, for people who were more asymptomatic than we can afford to do. But I think the number's higher than the cases shown daily by a lot.
Yeah. It's because let me tell you, I mean, some people, they can have it, but it doesn't show until
or ever. So you have about 14 days is what they're saying, 0 to 14 days, usually starting to feel sick about the 5th to 7th day. So I think that's part of the issue is you've already walked around and exposed yourself to your family, any friends, the grocery store, the gas station, whatever you've touched. And although it's not so contagious that just touching something, unless you touch your face, you may not contract the virus. I think there are more people out there that won't know they're sick until, a week has already gone by.
Wow.
Which makes it hard.
Yeah. And let me tell you, in your clinic where you work, right? What is the atmosphere? I mean,
I think there's been a little more fear this week. We were actually told to move out of our clinic today. So where I usually have practiced for the last 12 years, we have now consolidated all of our clinics from over 20 locations to 3 or 4, which you would say, why would we bring more people together? But I think we're trying to spare our staff, of course, from, losing their job or having to decrease a significant amount of numbers or for illness purposes. I think we're also trying to spare supplies amongst all of the physicians in our group. And it's going to be interesting because tomorrow is going to be my first day at a new clinic. And I'm still surprised that I have 15 or 18 people on my schedule that I'm either going to see live or on, telemedicine. So I think that slowly the numbers are trickling as far as comfortable to come out and see the doctor, particularly for our population, which is older. So we're trying, like I said, to, hold off on Medicare physicals on people who are elderly or maybe sick, and just try to do what we can online, and refill medications and,
Yeah, it is.
calm their nerves.
Yeah, I'm sure. So what do you think about, here in the United States, we can learn for other countries that already done, like Italy or Spain, they're dealing with this and they have
Yeah.
experience. Let's put
Yeah,
it that
I
way.
think
Experience, everything's
you're
new.
right. We've watched them in social distancing or complete lockdown for several days to weeks now in these European countries. And, you're still seeing quite a high number of people. I mean, I never went into medicine and said that I would spare the lives of anybody under 60, and anybody over 60, just leave them in a room to die. I mean, that's just unfathomable to me as a physician to ever have to be in that position. And I
Doctors are
understand we're going to run out
crying,
of
like,
beds.
how am I gonna put that on myself, then make the decision? I mean, that's
Right.
unheard
It's
of.
just not something I ever signed up for. And I don't know that I would be able to do something like that. And I don't know how they're doing that. And I can't even imagine being in their shoes. But I think even with the distancing, which we're not doing as a country, because if Italy says we're on lockdown, the whole country's on lockdown, it's different than each state making that decision, or even every mayor or county making the decision. For example, in my location, in the last probably 5 to 7 days, each beach has made that decision whether they were going to stay open or not. It is not a statewide decision where spring breakers are, overwhelming in Miami. But last week, when I was watching the people at the beach, it was unbelievable that they were still, at the bars, at the restaurants, ice cream shops, and on top of each other on the public beach, like nothing was happening in the world, because it wasn't here. So I feel like because we're not as a united front of 50 states making the same decision to do the same thing, and we're not in lockdown, we're going to start seeing different places who are maybe more prepared or had stricter regulations, like California or Ohio or whatever, doing better than us. I think they're going to bring the curve down, at least for their small world, which is the state of Ohio or whatever.
Yeah, and Florida, I was watching the news, and I believe it was a few days back when the governor said, please stay home, like this is dangerous and everything. And it's like the next 2 days, I mean, people's like, go to the beach and have fun or something like that. I mean, it was packed. And it's not just Florida.
Packed.
I mean, I'm not pointing fingers, but
No.
in Oregon, I mean, seriously, the governor, she was like, hey, you know what? Please, this is serious. Stay home, blah, blah, the social distance. Blah, blah. Everybody went to the coast.
Yeah.
And
because that's,
not very, and now in Florida, I don't know exactly the whole state, but some areas, it was like, see you next year.
Yes.
It's gonna close,
and they're actually patrolling the beaches in our area now. I really think that, at least in my small world, Venice, and the surrounding areas of Sarasota, Bradenton, Fort Myers, maybe those areas have started to make their own decisions. And I think it's been for the best, because it's coming. It's not rampant here. We're not seeing people all over, with COVID, but it's starting to progressively get higher numbers. And now we're seeing people that we actually know or somebody related. We had our first positive just 2 days ago in the small hospital in my community of Venice. So, Sarasota has seen it. Some of the physicians have it. It's going to only get worse by mid-April. So I don't know, if people don't take this seriously, as a state, we're going to run out of locations to put these people. Again, we're going to have a vent situation. We're going to have to compete with other states because we're going through it after them. So if New York starts to come down on their numbers, will they provide it to the next hotspot? And I think that's going to be very complicated, because who knows how long each person's going to require a vent or death. I mean, being within the first 10 to 20 days.
Yeah.
That's unfortunate.
I have a graphic, and I want to share with us your opinion, right?
Okay.
So here we go. Here we go. It's right there. Hopefully it's right there.
Yes, that really impacted me yesterday. Can you share with us? Yes, I sent that to you because that was the closest, most, shocking, I think, is watching how this death toll and our red line
Okay.
to, parallel to kind of Italy or Spain, who's on a pretty consistent lockdown for quite some time. I mean, they're really taking it seriously, and we're not, and we're going at the same pace as they are, which is not good.
Yeah, it's going up.
So
Quick.
it's going up, and it's going up steep. So I think that, that's the concern, is if we could have brought it down, such as South Korea, you see that slowly sort of fell off and then, has dwindled down, the lowest one, the orange. That's where we want to be.
Yeah, totally.
And we're not.
So you think this lockdown stuff, I mean, that's for the good? I mean, sometimes people's like, oh no, the government wants to control me, what's going on? But I think it's
I've
really
seen
good.
some governors that are like, get back to work, take one for the home team. If we're dying, we're old, it is what it is. Today I was watching somebody from Mexico who was saying the same thing. Every day we don't work, we don't have food on the table. So we're either going to die of hunger or lack of a home over our heads or whatever, because you're telling us to be on lockdown. And I understand the economy is what is concerning to the average person. If you live paycheck to paycheck, or even don't have enough with the paycheck, and now you're told that you have no job or you have to sit at home, I get it. I understand that.
Of course.
But if we do a better job of tightening down sooner, and we would have done this from like 10, 15 days ago, we would probably be over somewhat of the hump, maybe, at least in certain states, and we could have avoided what's about to happen in April.
Wow.
I think.
Yeah, totally.
Yeah.
Okay, you guys, I'm right here and having a good time, learning a lot, and just here with Dr. Sheeba. And let me tell you, I mean, like I said, this is not a news channel or anything like that, but I was very concerned. Everybody's concerned, and here in Just Be Blessed, we share, positive, shows, testimonies, and all this stuff. Everybody talks about coronavirus, and I was like, let's invite, doctors, stuff like that, and to share with us, and we have another shows, about pastors where they talk about this, or something like what's going on, and I invite Dr. Sheeba that she share with us. But let me tell you guys, we have a free offer later on. I'm gonna share with you guys what is gonna be the free offer that's gonna help us. I believe it's gonna help us also a little hope for this coronavirus. But I'm gonna share with you the free offer is later on. I'm gonna share with you guys who's gonna be a special guest next week. So hang on, and this interview is not over yet. We're gonna go back, and we have a lot of stuff to share. Okay, Dr. Sheeba, I have another picture.
Okay.
And I want to share with your thoughts about it.
Okay. Yeah, that one was kind of interesting. I saw that last night. So you had asked me, what's Kinsa? I'm going to ask you that today. Actually, I had to look it up. I know it's a thermometer company, but I didn't realize that they have actual live ability to see where their thermometers, I guess, have been. And they can't tell you what infection, but they can tell you that there has been a higher number of atypical fevers or diseases. So that includes just regular colds, regular flus, plus COVID. But as you see, there are certain states that are hotspots. And the concern is we live in the state with quite a large number of elderly population. Now, a lot of the red is people that are coming from spring break, people that have flown back maybe from New York, New Jersey. I mean, plus our regular, year-round, year-round people who are here just because. So we have people from Europe, we have people from all over the world in Florida, and the big, thank God, all of the big parks and amusement, is on shutdown, which has maybe helped, decrease the spread a few weeks ago. I don't know how long that's going to last, but this company is trying to do live sort of day-to-day checks on the thermometers, and I guess they can have live stream to see who's checking their temperatures and get somewhat of an idea, which is interesting. I
Yeah.
don't know how useful it's going to be, but I think it's another fact to add on to, everybody's trying to do their part to figure out how to slow this down, I guess. So
Yeah.
that's,
Yeah.
it's
We were talking.
pretty concerning.
Yeah. Yeah. For sure. And we were talking about a little bit of the economy, and
Hmm.
and it's not just individual or community or statewide. I mean, we talk about country. We talk about here in the United States.
Country.
I mean,
Right.
one of the countries of biggest of the world, right? I mean, we're kind of
Right.
suffering, and as American, it's like, no, we need to help each other. But the thing is that it's not just about health,
Right.
like you were
I
saying. I mean,
think that
if you
if you
don't
look
work,
at your community, I'm sure you have some wonderful, examples. I think one of the big um, grocery stores here in the Florida area and other states is Publix, and I have seen that they are hiring people that are in the restaurant business, the
Mhm.
waitresses, anybody they can find that obviously doesn't have a job and
Mm.
is sort of
Interesting.
on layoff or
Yeah.
waiting. At least give them opportunities to come work with the grocery stores. Or
Mm.
I think everybody's trying to find some way to help each person. We've had to decrease our staffing to 32 hours instead of 40, but this way, if we can try to maintain or keep our workers and not have to put them on leave, and yet they can still help out whatever and wherever they ask us. It could be in the hospital, at a different clinic. I think everybody's trying to find ways to avoid that unfortunate, layoff, which I've
Yeah.
already seen
Yeah. For sure.
happening.
Hmm. Yeah.
Nobody knows when we're going back to work or to school or to whatever your job might be. So I think, we're going to have to rely on our community.
Yeah. For sure. And I'm
The
so
kids that
thankful
are
for
not
that.
getting fed at school, the kids that rely on their breakfast and lunch, what are we going to do for these children? The kids that are in high risk homes that now are stuck at home
Mm.
and they don't have that freedom to go to school. I think all of these things are, you know, important. We can't just think about, economy and
Yeah. Yeah.
and
For sure. Yeah.
COVID. I mean, it trickles down in so many levels.
Yeah. It's
Um,
like it's seriously, this disease, this virus is, it's like attacking everywhere. You know what I'm saying?
every part of you.
And the thing is that, if whatever moves, whatever decision you want to make, I mean, everything you move, I mean, it's gonna hurt.
Right.
You know, and
Absolutely.
and I'm so thankful. The people, the business, trying to help the community, and
Right.
so it's
Right.
so great. That's a
Right.
huge
Right.
blessing. That's a huge blessing. Um,
And even nationwide, I think people are making masks. People know how
mhm.
to sew. I mean, I think people are trying to make
Already?
gowns. I think people are trying to do whatever they can and say, I'm a person that can make a
Mm,
difference, even if it's 20 masks to my local,
mhm.
emergency room.
Yeah. Wow, I didn't know that one. Um,
Yeah.
there's some people that are asking here, and I'm gonna share with you
Sure.
guys that
Sure.
share your questions. I mean, this is we have a doctor here, uh, live. And you have any questions or something? Please, share with us and share this link, because let me tell you, this is live show, and we have more time. We have 30 more minutes to go. So share this link, because I'm sure some people's gonna be blessed. All right. Uh, right now they're asking questions. David Dean, it says, how do we avoid layoff and practice social distances?
I mean, I don't know how we're going to avoid layoffs. Like I said, specifically for people who are in bartending, waitressing. I
Mhm.
mean, we have just told them that we're shutting down and we don't need you. We're just going to have carry out or close completely. I'm
Mhm.
really surprised how many restaurants have just completely closed.
Mhm.
So, I mean, they're going to have to look for other outlets temporarily to
Mhm.
try and pick up the ability to find any job, I think. And that's why I brought up the grocery store for
Yeah.
that particular group of people.
Yeah.
How do we practice social distancing? That's pretty tough because people still want to go to work and make a dollar. So
Mhm.
that's why I feel like we are behind the times somewhat. I have listened to other, presidents and head of states in other countries, and they just said, this is what we're going to do for you. We're going to decrease your mortgage for 3 months. We're not going to take your electric bill.
Mhm.
We're not going to make you pay your water. We haven't had that. So I think it's not reassuring
Mhm.
not to know how much money is out there
Mhm.
or if there is going to be any money out there
Mhm.
provided to these people who are living paycheck to paycheck. you
Yeah,
know?
yeah, for sure. I have a okay. This David Dean says, shouldn't we shut down and reboot?
Absolutely.
Mm.
But I'm not in control of that. Ask your governor.
That's a good.
I think the hospitals have been begging for weeks now that we're going to have what they have in
Mhm,
New York, etc. And we're a
mhm,
small town. So, I mean, if I look at my small town versus
mhm.
Miami, we're going to be in trouble. We're not going to have the ventilators. We're not going to have the hospital beds. And I don't know what
That's
we're
a
going to do.
that that was one of the questions I want to ask you. I mean,
Yeah.
because last week, I had a doctor, Tamara Stewart.
Uh huh.
She shared with us, and let me tell
Mm
you, I
hmm.
mean, back then, I mean,
Mm hmm.
I forgot the statistics of how many deaths today.
Yeah. Yeah.
But last week, she shared with me, and I believe, I don't know if I have it here. Sure. Yes, I do have it here. I just want to share with you, you guys. This statistics, it was from last week. Okay,
Mm
so
hmm.
check this out.
Yeah.
That was last week. That was March 14. That was last Saturday. No, not last Saturday, but the last one, right?
Right.
And the deaths in the United States, that was 2,800.
That was last week. That seems awfully high
Yeah, it
already at
was.
3-3.
Yeah, that was March 14. Okay,
Right.
and
Okay.
we were talking about that in March 16, 2 days later, and she told
Mm-hmm.
me before we had this interview, we had the interview, it was
Mm-hmm.
4,400.
Yeah. I mean, I think the numbers aren't even going to be accurate there because people don't have time to stop and figure it out. And plus,
Yes.
some of these tests are going to come back after their death as, oh, by the way, that guy was COVID positive. So you see that all the time too. So I think the
Really.
numbers are probably even higher. Um,
And right now, I
if you
believe
look
it's over 15,000 in the United States.
that are deceased,
Infected. Yeah, infected.
infected. Okay,
Yeah,
because the number of deceased is rising, but that's yeah,
yeah,
the number infected, it like I said, is
yeah.
probably double or triple what you're having as a number on the television set because we're not testing people
That
that
is
are
not
not
good.
sick enough. Right? That is not good, but we need to keep the amount of supplies that
This.
we have. And I think it's getting better. Today, I was
Mhm,
looking at a lot of the physicians around the country on how long it was taking to get the COVID
mhm,
results back. And I know for us, it was maybe 5 days a few days ago. Now they're coming out with faster ones. So today, there was a lady who stated it only took 45 minutes at NYU to get the result back. That's huge because they were at 24 hours yesterday and now they had someone that they could get the result back in 20 in less than 24 hours. So 45 minutes is pretty amazing. um,
mm,
and that's what we do in the office for flu. If we just have them sit there for 10 or 15 minutes and tell them they're positive or negative, which would be amazing. 5 days is 5 days too late. Unfortunately, I read a lot of articles of people who didn't get tested and are deceased now or didn't get their results back. And
mhm,
so they didn't get the possibility of treatment with the medication or
mhm.
treating them more like COVID than just a regular pneumonia or flu. And that's unfortunate to see young people dying, that we may have been able to do something if we had the right treatment.
Mm,
And again, we don't have great treatment. So we're using antivirals, but we don't
yeah.
know, if that's the right answer for everyone.
So we hear in the news that we don't have I mean, anywhere, I mean, the whole world, I mean, the medicine, I mean,
Mhm.
the
The
vaccination or the
antivirals, yes.
antiviral and all the stuff. And they say it's going to take like a year to
Yeah,
make,
I mean, I think by the time we can manufacture as much as we need for what's going on currently, that's going to be impossible. I think, it's only going to get worse. Um, we're going to be at a shortage. I think
Mhm,
everybody thinks the vaccine is coming out this week. Um, it's not going to be like that. I know they're running trials faster and they're trying
mhm,
to get through some of the red tape quicker
mhm,
as far as vaccines and testing and medications, but
mhm.
I don't know how that's going to help in the next 4 to 6 weeks,
Yeah.
as we go through the peak.
So how you and your team, uh, you guys can be protection for this crazy virus?
So I have to be honest. I mean, when we were at our clinic, we were wiping everything down. Everybody was stopped at the door. We're checking everybody's temperature, including all of myself and staff.
Yeah.
Before we get in, we have to make sure that we're okay. Then any patient that comes in, they have to wait at the door, be checked to see if they qualify to come in. They have a fever, where have they been? And we have been able to kind of protect our surrounding at the clinic by wiping down, having the materials we need. And again, like I told you, we're not seeing COVID in the clinic amongst our other healthy or semi-sick patients. So we're really not at a big high risk. I think the hospital is where we're running out of gowns again, and gloves, and the protection for your face. I mean, I'm walking around with my son's goggles from competition for building things for engineering, and I had a mask, and that mask is being reused day after day since Monday, and we'll make it through Friday, hopefully. And just protecting ourselves the best that we can, and good hand washing while I'm with the patient, so they see that I've done it after I've touched them, and trying to make this work. So
okay, I have a question. Daniela Bowling. How you doing, Daniela? It says it seems like if everyone could do it all in once instead of here and there, it would be more effective. I mean,
right. And I think that's where we're not a United States. We're supposed to be a country that does everything the same. We should be like Italy or Spain or wherever. And I think that's where we're looking at our governors. One says yes, one says no, and they're put in a position to decide, well, how come this guy's bar is open, my restaurant can still serve? And I think that was kind of complicated in the beginning, who does what, or what we're going to shut down, or what we're going to keep open. And that's confusing. I think that's very difficult when you tell one person to do something, but the other people are doing something different. Easily a great example is my daughter shows me pictures of her friends at the beach, and I said, I thought the beach was closed. And they, said, well, we found one that was open. It's just that easy. So, where there's a will, there's a way, and they just don't get it. They're not going to die from it. That's the same thing I hear. It's not a young person's problem. It's not our disease. However, I tried to explain to her that if she gets it, then I'm out 2 weeks and I can't help the rest of my patients or go to the hospital if needed, because now I'm on lockdown or in quarantine, or my parents get sick.
And that's the thing, because I mean, we need our doctors, right? We need people there, and they're sick. I mean, they're gonna be gone for 2 or 3 weeks, and or something like that. It's a question here from Jose Antonio Morales.
Okay.
It says, what opinion do you think what the president of Mexico, what he's doing? I mean, I don't know what Mexico's doing.
Yeah, I was just listening today how we need to get back to work. And I understand that fear of not having an income, and everybody needs to do their best to work. I still feel that social distancing is going to be our best bet temporarily. I'm not saying for 10 weeks. I'm just saying, even if we would have done 2 weeks, by now we would have almost been through the hump of at least attempting to keep it under wraps. Now I think we're going to see the economy for a longer period of time in crisis, because I think we're going to see that the numbers are going to start to spike, and then we're going to be on serious lockdown as a country, hopefully, and it's going to take a lot longer to get out of it. That's my feeling. Again, it would be crazy if we don't follow what's already happening in other countries and learn from them, their mistakes, the things that worked, and sort of put that into our governing and our country and say, okay, let's do this. And we're not, which is putting healthcare workers at a higher risk. Every day they're turning positive. They're tired. They can't go home because they may be positive. It's a lot of stress. I think it's only going to get worse.
And right here,
on a positive note, though, I did see that 40,000 people did come out for New York, out of retirement, or to help out, whatever type of healthcare worker. 40,000 people giving that back to the community is huge. I think that's a positive thing.
Great.
So we need to bring that up. There are a lot of good people out there trying to help however they can help.
All right. Well, thank you so much, New Yorkers. Right. Another thing we're saying here, 935 deaths so far in the United
Yes.
States.
Yeah.
The
That
dead
seems more
people.
realistic. Yes.
David Dean says, Doctor, how do we keep these young, healthy people from understanding the incubation
Patient.
period?
Yeah, I mean, I'm dealing with two teenagers at home that are getting
Mhm.
restless and bored. I get it. I understand that. And they don't understand because they're invincible as well as their friends.
Yeah.
So I think, I mean, if you can, I think that a lot of the media was going up to teenagers or these, 20 something year old spring breakers and saying, who do you live with? I live with my grandmother. Okay, so now you've just killed your grandmother because you were out not social distancing.
Wow.
In fact, in the biggest crowds on the beach, in the bars. And, I think some of them actually listening to have got it. It's hard to tell someone that you're isolated at home and you're not in trouble. They don't understand it's not a punishment. This is just the new reality until we can get through this.
Mhm.
I'm just going one person at a time. I think,
Yeah.
if you're watching TV and you're hearing that other people are tested and they're
Mhm.
standing around, such as our governors that still went to the gym that should have been closed, but was tested and was positive and now spread it.
Mhm.
If he's invincible and he can do it, why can't I?
Mm.
Very difficult, I think,
Yeah.
to say, oh, I'm waiting for my test, but in the meantime, I'm going to go around and spread it and then go, I was positive. I think that's not the way we should be handling it.
Yeah. Yeah. For sure.
So,
Um,
and distancing doesn't mean you can't go for a ride on your bike or go for a walk or exercise with your family or get into some routine to live healthier, which is my next big thing on positivity, is that out of this, you may actually get to know your family. So for someone like me who's running around every 15 minutes, going to volleyball, taking one kid to robotics, walking the dog, going to work, going to the clinic, I think that for me, this is almost a vacation. I don't have to get up at 5:30 in the morning. I can see my family more. I have less responsibilities after work. And I think even when they're home doing less right now that they're not in school, and I think that'll change when they actually have a curriculum and they have to have, class work done during the day, this would be a great time to get in shape, go for a walk, exercise, do other things.
mm.
As a family, I think people are doing game nights. I think, you're actually sitting at the table and eating together because you're
Bring us
quarantined
together.
together. Yeah, I
Yeah.
mean, it's crazy. It might drive people crazy, but I
Mhm.
think it's a good thing.
Yeah, 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 for
So
sure. I believe the name is Sina uh, Mesghali
Mescali,
Mescali.
yeah,
Okay,
yeah,
it
I know that
says,
guy.
yeah, I know, right? Is your family member or something?
Yes, cousin in Canada.
All right. So is there
Yeah.
is there higher danger for people having diabetes?
I mean, I think they have mentioned, and again, I'm in this group from all over the country, various doctors at all different kinds of levels. And
Yeah.
yes, I think that they have stated that comorbidities don't seem to help. Obviously, respiratory being number one, smokers, COPD, but I think even mentioned was obesity and comorbidities like diabetes, autoimmune disorders, of course. So I think that, yes, that does put people at a higher risk, as does the flu. I mean, so this is no different. We would still tell you get your flu shot, preventative measures. So, unfortunately, yes, that does put them at higher risk.
Okay. All right. So it's another question, very important question, because let me tell you, there's some people, they're vegetarian or
Yeah.
vegan, you don't eat meat, stuff like that.
Mm-hmm.
So it's a question from Jared Bowling. By the way, it's my friend. How
Mm-hmm.
you doing, Jared? It says, what are going to be the ingredients and the vaccines? There's one
Great
question.
question.
There's one
Yeah. I mean,
question. Okay, go ahead.
who knows? I mean, that's something that I have no studies on. I don't know what they're going to mix or what they are already, it's already out. Some people are being tested with this. So,
Mm,
um, I was watching maybe 5 days ago, one of the men that was part of this trial, and he hadn't had
mhm,
any side effects. And,
mm.
it seems like whatever they usually use for vaccines. And unfortunately, I don't think it's, I don't know if I can say it's vegan, but I don't
Yeah.
know if they're using egg.
Okay.
I don't know.
Okay. Another question that he has: he'll be vegetarian friendly.
Will it be vegetarian? I'm not creating the vaccine, so unfortunately, I can't really comment on that. I have no idea.
Okay, another question that he has: is there a way of checking the ingredients or checking what's in it or something?
I believe there is always a possibility of checking.
Okay.
Yeah, I'm sure if you got the box and the label, you can look it up on everything's online. So
Yeah. Just be careful what you're putting online, right?
right.
Okay. I'm gonna go over here and this. What is your thoughts about? I believe it was a couple days ago. I'm gonna show it here so you can see it. Everybody can see it. The general surgeon here in the United States says this week is going to get bad. So this week is going to get bad. We're talking about, I believe, is 2 days ago.
Yes.
I believe his name is U.S. Surgeon General Adams.
Yes. Jerome Adams.
So, what are your thoughts about that?
Yeah, I mean, I 1,000% agree. I think that, nobody wants to listen to the healthcare worker because we're asking to have everything shut down, which doesn't really benefit the economy. I get that. But if you're sending us to be the front line and you're asking us to sacrifice our people, our lives for patients, then you need to do the service of, providing. If you can't provide ventilators for everybody on this planet, then at least try to decrease the amount of people that are going to be very sick, particularly in Florida, very, very sick. We've got congestive heart failure and COPD and, the worst of the worst, the sickest and the oldest. And I think that that's going to be where our crisis is going to be coming up. It's assumed in this area mid-April, but I mean that this week is going to be bad. Yeah, we're already seeing how many, the numbers jumping on the deaths just in 2-3 days. I mean, it's pretty amazing how it's quickly starting to look like Italy. I mean, and I know they've done, side-by-side studies by the dates. And I think he's right.
Okay. All right. So a lot of people, parents, they're very concerned about the children. And I believe it was yesterday, a young child, I believe, I don't know.
7 months.
7 months.
7 months old, I believe.
I'm going to show it to you. A California child dies of the coronavirus, and they were thinking, before when the beginning of this crazy virus, it was going global. They was only for older people.
Older people.
Yeah,
and I think that's a big misconception. Just speaking to people around the country, they're seeing 20-year-olds on vents and 40-year-olds, and they may not necessarily die, but they may be very ill. And, we just haven't seen a lot of children, especially in my area. I'm a pediatrician. We've had no positives that I'm aware of in this area. And again, we're not screening because a lot of these kids are asymptomatic. So even if they bring it to their parent or their grandparent who's taking care of them, that's where you're going to probably figure out that your child was the one who brought it home. But we're not going to know that.
Wow. I mean, that's a little crazy, let me tell you.
A little crazy. But imagine, I mean, if you look at the China numbers, even a lot of kids did get infected, but you didn't see any deaths, which was really promising. So I don't think we've seen much talk on that in Europe or in Asia. And I don't think it's going to be a common thing. But again, if you look at chickenpox, if you look at the regular flu, how many children die a year and we don't even stop or bring it up on media? It's just one of those things. So I think, in the spectrum of things, kids are dying of a lot of things. We're just not talking about it. So one death is really, not that it's insignificant, but that's pretty low on the radar.
Like you were saying in the beginning, it's new thing, and you guys, doctors, they're kind of like studying about this, how these viruses react, and it's
all new. I don't think we don't have studies. We're just winging it and trying to take some notes along the way.
And like here, like yesterday in California, I mean, that's the first young kid just died from this virus, and we hope it's
I didn't really get any information, so I don't know. Was he autoimmune deficient? Was he a preemie? Did he have underlying respiratory disease? I don't know. I didn't see any of that information, so I think that, again, will be something that we have to take into consideration on the weaker.
What about those people that have autoimmune disease, like, I believe it's lupus or
Lupus, a
lupus.
multitude of medicines that they use prednisone for that may bring their defense down, or they're on biologics or whatever their medication might be that may affect, their ability to fight
Hashimoto's,
any infection. Any infection.
Okay, so that's for those people that have
autoimmune
disease, is more in danger to get the virus.
Absolutely. Yeah, because their defenses are less
attacking,
than Yes.
Yeah. Wow. Okay, we almost at the end of this interview. We have like I don't know, like 10 more minutes or so. So before we're gonna finish, so stay here, you guys watching live. I'm gonna tell you guys our free offer, because we talk about our health and dangerous, the virus and dying people and everything. But let me tell you guys, we have a free offer. That's right, we have a free offer, and I'm gonna show you what the free offer is. It's a really nice magazine. That's right, but it's digital magazine. That's right, with the digital magazine. And it's a really cool one because it's about amazing health facts, 8 Bible secrets for a longer and healthy lives. And let me tell you, if you guys, I'm going to put the link in our comments right here, right now, and you can go check. And let me tell you, you can check that link and you can have that free download. And I believe it's like 30 pages. And you can look at it in your iPad or computer. It's free download. Just put your name and all stuff, and I send it to you in the email. And it's beautiful, really nice. The one thing I really like about this magazine is Bible and science together, and it's a really good information. So I just want to share with you guys. There's a free offer for tonight, and share with your friends. Copy the link and share it, and it's really nice digital magazine. So you can, a lot of people there in their home, want to read something new or something like that. Go check it out. There's the link down there. And let's go back to finish this interview. And I'm so excited that Dr. Sheeba is here in Just Be Blessed. And seriously, thank you so much for hanging out here with me and accepting the invitation here in Just Be Blessed.
Absolutely.
And please, your final thoughts. Oh no, before I forgot, because I almost getting forget about it. Let me tell you, Dr. Sheeba, she works for 12 years in this building, but this building is very nice about her and her team. They have a free clinic or something like that. Can you please share with us?
Yeah.
I believe it's right here. I'm gonna show you right there. Please share with us. What's called Good Samaritan.
Okay, so Good Samaritan Pharmacy and Health Services is something I do on the side. So it's really not related to the clinic I work at every day.
Oh, okay.
This is something I do out of a different building with a multitude of volunteers. So we have one person that is hired to sort of get all of the grants written, go into the community, try to find money as we don't get any government funding. And I have a lot of my patients, some of the elderly population, high school students, and from the volunteers for the pharmacy and physicians to help out to make this work 5 days a week. So we see uninsured or underinsured patients who would otherwise have no way to get their medications on a monthly basis. So during this crisis, it's been amazing to see how we came together through my spring break and most of my staff's spring break to get all the prescriptions that we could done per week to make sure they have 2 months supply while we're closed. We just felt that it was too risky to let people in to be examined. So we can't leave them without their medications so that they can live, because we see a lot of COPD and a lot of diabetes, and they need to stay on their medicine. So we are actually going into the community by car and setting up at the Goodwill store across from the clinic, so they can come pick up their prescriptions, sign for them, and provide them with a pen that we don't get back. So, keeping my staff safe with gloves and masks, and the patient gets their medication for 2 months instead of the regular monthly prescription, so that they don't feel abandoned. We're open for their phone calls or for any refills. And so that has been working fabulously through all of this crisis. It's amazing how many pharmacy students and physicians and pharmacists have come together to get these prescriptions taken care of and then back out into the community. It's been fabulous, actually, working very well. So, and we are open to see patients once a week. So it has been a huge reward in my life to pay it forward and pay it back. So
that's great. Thank
amazing
you so much for
people.
Thank you so much for you guys, you and all those people, they doing that for the community and to help others. And I believe this is so great. I have 2 questions before I forget about that, and then we're gonna go to final thoughts. And then we're gonna wrap up this thing. Okay, I have 2 questions. One, very important, is I believe his name is I'm not very good at names. Okay, Douglas Colbert. It says, what is your advice for patients who currently take hydroxychloroquine?
Hydrochloroquine?
Yeah, I think so. Yeah.
Hydroxychloroquine. So that's Plaquenil.
Daily for diseases such as lupus, who can no longer get their daily prescription because they are being told all current supplies are being pulled for COVID-19. Is there is this safe for them to stop this medicine suddenly?
No. I think, unfortunately, we found something that's been brought up and maybe shouldn't have been brought up on the level of stating it out loud on television. And I think that's going to harm a lot of people that need their day-to-day Plaquenil. Even Zithromax, which is what we use for typical pneumonias, bronchitis, upper respiratory, may run out. So I think what I have seen from other pharmacists is that they're not allowed to prescribe it. And obviously it's written a different way for prescription than you would for the people that take it for lupus. But I think we're really trying to keep what we have for the critically ill inpatient versus me and the rest of the people on the in the community getting it for prophylaxis just to have. So I know right when that information came out and people started seeing a high supply of prescriptions being ordered, they somewhat stopped it. That doesn't mean we're unfortunately not going to have people that are without it. And that's going to be quite difficult. I know they're working on producing more of it per se, but again, what does that mean? Is that a week from now or a year from now? And I think it's going to be harmful to them. Absolutely.
Yeah. Thank you. Thank you for, answer those questions. The last one, and I promise. All right. The last one is, how long does it take to recover from coronavirus? I heard that up to 17 days. I don't know if it's correct.
Yeah, I think they were talking like an average of if you're going to be really sick, it's about 17 days. So I think that we would still say if you're positive, you probably stay 14 days away. And we don't even know if you got it 7 days prior to that. So I think, if I was going to work and they told me, 5 days in that I now have the virus, I think they would still mandate the 14-day quarantine, which means it could have been 19 to 21 days. I don't know when I contracted it.
Wow.
Until I saw, symptoms and then got treated and then got better.
Yeah.
And I think it's also dependent on your age and your comorbidities and your lung function. I think everybody's going to be different. I don't think I'm going to be the same as the 80-year-old who's on oxygen on a regular basis.
So I think it's the time right now to Be healthy, eat your veggies. You know, remember
Exercise.
exercise.
Try to stay positive.
You know, and
Absolutely.
yeah, totally. And let me tell you guys, right now, like I said, you know, I mean, we had this free offer, right? I mean, if you guys want to read it, enjoy it, share this link. I mean, you can put it in your
Sure.
lap, in your computer, stuff like that. You know, very interesting, you know, information, be healthy and stuff like that. Interesting. Your final thoughts, please share with
I think my
us.
final thought
Mhm.
is don't panic. I think that we're seeing a lot of frenzy. I think people are really uber focused on what the media is portraying this as. And I'm not, I think that it is very
Mhm.
serious and I don't think we're taking care of it as we should. But if we can't get our government to shut down 50 states, then we're going to have to sort of do it by community. So I think, all we can do is be that one social distancing and not looking to others, but trying to encourage others. It's unfortunate we're not all on the same page. Some people are taking this very seriously on complete shutdown from the world, and other people are out, on the beach having a great time. So I think we just need to come together as a community, do the best that we can,
Mhm.
help out however we can, and know that we're going to all go through this and we're all going to get through this. And there will be life as we know it, hopefully, on the other side.
Okay, that's great. Thank you so much.
Thank you.
Thanks so much for being here,
I
hanging out here with
appreciate
us,
it.
and all those questions and all stuff.
Yes.
Uh, it was
Good
it,
talk.
it was great.
Good
It was a
talk.
nice. Thank
Yeah.
you. You see, it was very nice. I told you it was casual, right?
I
I
was
mean,
terrified.
no,
Okay.
it
I'm
was
feeling
great.
good.
All right.
Let's do it.
Okay, maybe we need to invite Dr. Shiva once again. What do you guys think?
Once again,
You know,
let's see
share
where
with
we
us
go with
in
this
the
epidemic.
comments.
Yeah.
Okay, I just want to tell you guys, next week, our special guest is going to be, we're going to be sharing a testimony. That's right. We're going to share a testimony. Ryan Day, he's going to be sharing with us his experience from a cult to Christ. So he's going to be sharing his experience. And let me tell you, this brother, when I met him, I mean, he was preaching the gospel. I mean, he's a preacher and share, evangelist and all the stuff. And he sings very nice. I mean, he has a career about singing. And when he shared with me story, I was like, I need to invite you. You can share your story here and just be blessed. So he's going to be here next week in March, on Tuesday at 6 p.m. Pacific time, March 31st. So, like I said, here in Just Be Blessed, we share people's testimonies, and I've left him messages just like this one with Dr. Shiva, sharing good stuff, and let's have a nice conversation. I mean, you hear some stuff in the news, stuff like that. So I was like, you know what? Let's invite a doctor, a person that knows about this kind of stuff. They're in front of the line, and let's have a nice conversation. So thank you so much for hanging out here with us, and share this link, because let me tell you, it was a lot of good questions, people here, and share this link so other people can be blessed. All right. My name is Alex Castillejos here in Just Be Blessed, where we share people's testimonies and we have a left in messages and how God is good. Thanks so much, and I'll see you next week. God bless you. Bye-bye.